Hello, I'm Dr. John Warner, President of the American Heart Association and American Stroke Association. And I'm here in Los Angeles, California at the International Stroke Conference. I'm here with Bruce Ovbiagele and with Dr. Miguel Perez-Pinzon, the chair and co-chairs of the conference. Bruce, tell us a little bit about some of the highlights of the meeting.
Oh, thanks, John. I think we have a very exciting program this year, probably one of the best ever, but why would I say that? But I think a major theme, definitely in terms of the science, is acute ischemic stroke management. And so we have several compelling trials that were presented at ISC this year, but we also, for the first time, will be unveiling the acute ischemic stroke management guidelines. They'll be released tomorrow, and that's going to be done for the first time at ISC, simultaneously published in the journal Stroke. But there are several compelling trials, most of which focus on acute ischemic stroke due to large vessel occlusion. So for instance, we have the Diffuse 3 trial. This particular trial looks at a population of patients who've been identified using neuroimaging indices of salvageable brain tissue. So these patients have been randomized to either thrombectomy versus standard of care. These are patients who are presenting beyond our current therapeutic window between the time 6 hours to 16 hours after the index stroke occurred. So potentially this trial could show results that will actually change practice and will expand the number of acute ischemic stroke patients with large vessel occlusion that we could treat. Another trial that we are going to also be hearing about is the Extend IA-TNK trial. And this particular trial is looking at genetically modified version of alteplase called tenecteplase. It's given as a one-time bolus as opposed to a 1-hour infusion. And it's looking at patients who have large vessel occlusion yet again, but have planned thrombectomy going to be done. Again, this could be practice changing because the only FDA-approved treatment is alteplase, and so this could potentially inform practice as well. We have other trials looking at different thrombectomy devices. We have the RISE-2 trial being presented. We also have the COMPASS trial being presented. But beyond large vessel occlusion, we're also going to be hearing about patients who experience minor stroke that's not disabling. And this is a population that otherwise would not receive TPA necessarily. And so one of the trials called the PRISM trials, we're looking at these patients, randomizing them to alteplase versus standard of care. Another trial that's being done in China is looking at an agent called ticagrelor and comparing it to clopidogrel with background aspirin treatment. So those are some of the acute ischemic stroke trials we're hearing about.
Well, that's certainly a loaded program for acute ischemic stroke, and with the guidelines coming out this meeting, that's going to be a very important set of information for any clinician, not just neurologists, but for the whole medical community. Miguel, you want to tell us a little bit more about the science at the meeting?
Okay, yeah, in addition to the trials that was mentioned, I would mention a couple more. The COMPASS trial that is looking at the drug, the anticoagulant, rivaroxaban, with aspirin or without aspirin, and it's looking at patients with atherosclerosis. It's an interesting trial. It's going to be looking at the risk of incidence of strokes. It is going to be looking at the other parameters that are important for stroke incidence. In addition to that, there are a lot of basic science going on in the conference. Really exciting. I'm just going to mention a few. We have tomorrow, for example, there is a group from Pittsburgh that is looking at study looking at endothelial cells. They're deleting a number of microRNAs that promote angiogenesis in post-stroke. On Thursday, there is an interesting study from a group in Houston that is looking at the microbiome from juvenile mice that is releasing certain factors that promote protection in aged animals. That's a really cutting-edge, very interesting study. Finally, I would mention another one from Detroit that is looking at microRNAs that come from exosomes from endothelial cells and neural stem cells. Finally, I want to mention that we also have Game of Strokes.
Right, so we have lots of returning favorites on the program, Game of Strokes.
Yes, which is one of our champions from last year that really serve as the educational role in our conference.
The other two returning favorites are the crossfire debates, very, very popular, and this year we'll be taking a look at issues like whether hemicraniectomy should be done in individuals above the age of 60. We're looking at prolonged cardiac monitoring, should it be widely used? And we'll also be looking at the issue of if and when you should initiate anticoagulation after an ICH, which is also a very controversial issue. We also have the SED talks, the cerebrovascular education and discovery talks, which really are these lively TED-like talks given by leaders in the field. And so we have Dr. Ferrero talking about neonatal stroke. We have Dr. Barth talking about blood pressure management in the acute stroke setting. We have Dr. Brott talking about these declines we've seen in stroke mortality. Can we expect them to continue? And then finally, we have Dr. Anton Hakim talking about small vessel disease. So very exciting returning favorites, I think. We also have, for the first time, several international collaborations with the World Health Organization, the World Stroke Organization, the World Federation of Neurohabilitation, the World Heart Federation, the Chinese Stroke Association, for the first time even the African Academy of Neurology. So lots of international collaborations, joint sessions targeting areas of interest between the American Stroke Association and these various allied international organizations.
Well, I want to thank you and congratulate you both on a terrific program. This is an amazing meeting, and this is such an important time in stroke care and stroke science. It's hard to imagine in our generation a more important time in terms of innovation for new care delivery models, as well as the science behind improvements in stroke care. So we look forward to a terrific meeting, and thank you to both of you for creating and implementing this terrific meeting.
Thank you. Thank you. Thank you.